We are talking to Denis Vujicic, managing director of MSD Poland. Hello.
Hi, it's great to be in Krynicy again.
Okay, my very first question is: are we dealing with a breakthrough in treatment of lung cancer?
Well, I hope so. And actually, the question that you have asked has been recognized even yesterday at the ceremony, at the award ceremony, where our company actually received a special award for our immuno-oncology drug. Which was a fantastic achievement for us because it was a huge recognition to this really breakthrough treatment in the oncology, which is currently reimbursed in Poland in first-line lung cancer, but also in melanoma.
But there is a long way from award to reimbursement, especially in Poland, right?
Yeah, I mean, well, when we talk about immuno-oncology, we have to acknowledge that 2019 has been quite successful in Poland in terms of the access for the patients for the immuno-oncology, because they actually received treatment or the access to treatment in melanoma 1 year before, and also in lung cancer in first line. But as you said, this is not enough, because actually ever since the cracking down the human genome, which gave birth to the whole new discipline in healthcare or in treatment, which is the immuno-oncology, we actually see new drugs being brought to the market, which are not anymore related just to one indication. So the immuno-oncology drugs that are coming to the market through the various clinical research are actually showing benefits in various indications. So we cannot rest until majority of these indications where there is abundance of data compared to the existing treatment is reimbursed, which means that the patients in the countries like Poland have access to it. And I think that we are not even halfway here in Poland, because currently, as I said, we have it reimbursed for melanoma and for lung cancer first line, but there are also additional cohorts of patients in lung cancer which cannot receive this treatment now. So our company is filing for the reimbursement in combination of our immuno-oncology treatment together with chemotherapy. But also there are some other indications like adjuvant melanoma in the future, like renal cancer and urothelial cancer, that the benefits will for the patients will be tremendous in comparison to the current treatment.
I would like to ask you more generally. Can you compare Polish reimbursement policy to European? But I would not ask about comparing Poland with Germany or France.
Oh, sure.
As far as I know, you are Croat.
Yeah, I'm Croatian, but let's not even go far to Croatia. Let's stay within the V4. Let's stay within the CE or the Visegrad countries. So, for example, we are welcoming the strategic decision of the Polish government, who actually, in line with their strategic priority, which healthcare became, has decided to invest more of the country's GDP into healthcare. Currently, it's around 4.6%, and there is a clear decision to invest 6% of GDP in healthcare. Now, the question is, where is this additional money being invested? Because we know that there are requests, and there are rightful requests from the healthcare professionals to increase the salaries. That's one way where you can invest. Then in the hospitals, in the hospital system, but also in the new therapies. And coming back to your question, we understand that, for example, the data is showing something like what you have mentioned. In Poland, 0.5% of the total GDP is spent on the reimbursement of drugs. In the other 3 Visegrad countries in the region, it's 1.2%. So basically it means that the investment in the new technologies is double in Hungary, in Czech Republic, and in Slovakia than in Poland. Now, this translates immediately into the access for the new treatments because, for example, out of all the drugs that we have in the Polish market, only 0.3% of the drugs currently available in the market are the ones that have been reimbursed in the last 10 years, which we can refer now still as innovation. This number in the other 3 countries is at the level of 3%. So we basically can conclude that in the other 3 countries in the region, there is 10 times more of the novel treatment available and accessible to the patients than the ones that we have in Poland. We have to acknowledge that this government is doing a huge step in changing this habit, but still there is a long path to go towards what we might see as appropriate allocation of funds to the innovation. And maybe to conclude this just by saying that why is it important to invest in innovation? Because there is abundance of data that is showing that investment in new drugs is actually prolonging life. So the life expectancy, the 73% contribution to the increase of the life expectancy in the last couple of years is actually related to the usage of the novel treatments. Be it immuno-oncology, for example, like in lung cancer, because the people who were basically dying a couple of years ago within the diagnosis, so after diagnosis within a couple of months, now live much longer. And
how much?
Well, that's the question. I mean, I cannot say how much because we know that the certain immuno-oncology treatments are doubling the life expectancy of the patient right now, for example, in the first-line lung cancer. But we expect, so with immuno-oncology now, we are the closest point to potentially curing the cancer. It's still not, we cannot still say that we are curing the cancer, but this is the closest point that we have reached in the history of healthcare by being close to solving the cancer problem. Yeah.
So finally, my last question, what is your prediction? Do you have a good news or bad news for Polish patients suffering lung cancer particularly?
I think, well, I would like to revert to the question because I think it's a question that everybody should ask themselves. So we as a producer, as a company that has, so it's our objective and it's our goal to bring the best medicines and the best vaccines in every country where we operate, and this is around the world. For the payers in the market, I think that there is obligation to provide the available access, to provide patients with the access to the drugs that are available in the neighboring countries at least. But also there is an increasing role of patients into that process, because I think that the patients themselves should work together with the companies and together with the payers, with the Minister of Health, in simply understanding the possibilities, in knowing about the possibilities about the drugs available in the market, and then also seeing how can they get access to these drugs. So it's not a question to the company or to the payer. I think that it's a trilateral discussion that is needed in that context, and then also to evaluate which of those drugs will provide the best benefits for the patients. Currently, every country in Europe, including Poland, is struggling to cope with the pace of population that is getting older and older with the disease, with more and more prevalence. So we need to find a way how to create the budget headroom for the drugs that are helping the most in actually keeping patients in good health. I think that the whole society should be engaged into that discussion.
Thank you very much.